There are side effects to life,
Right.
you know?
Yeah.
Yeah, yeah.
So I'm just
I got to get the money for that, though, if y'all make that a bumper sticker, 'cause I got some student loans to pay off. Hormones, just FYI, I've been taking testosterone since 2004. It is a drug like no other. Going through puberty at 24 when I started, wow. For those of you that have maybe sons or work with adolescent boys and they're bouncing off of each other and bouncing off the walls and hitting each other and wanting to do other things that aren't appropriate, they can't really help it. You know, I mean, I was 24 when I started testosterone and I was bouncing off the walls and running around and hitting, you know. Coming out, you've got to consider other people's feelings, you know, and sometimes you're ready to just get out there like gangbusters, you know, and you're prepared, but maybe the people that you're interacting with aren't prepared, and sometimes you have to work your way back into the closet. I want to just start off with a disclaimer. This presentation, this is all just my words, my own experiences. I certainly don't represent, you know, the black community. I certainly don't represent the LGBT community. So these are only, you know, my words, my experiences. Other people may have had completely different experiences. Okay, so these are my parents, lovely hippies that they were. This was circa maybe, I don't know, November 1979-ish or so. I was born in 80. So my loving folks here, I'm sure that they never saw what was coming. So when I was born Michelle Christina Mays. My mom often says I was born in California. My maternal grandparents were back here in Ohio. So my mom, you know, called them up and said, you know, hey, you've got a new baby, you know, and put me on the phone with them. And they thought that I was a boy because my cry was a very low sounding cry for, you know, a girl. So I guess that was my first little inkling of some gender nonconformity. My parents divorced, moved back to Athens, moved back to Ohio from California, and, you know, just sort of started life. The idea that, you know, gender is set in stone, you know, just because you come out of the chute, right, with X or XY or what have you, doesn't necessarily mean that that's how you feel on the inside, right? I think that's the main piece to keep in mind, is that there's more to you than the surface, right? Don't judge a book by the cover. So people say, well, how did you know? How did you know that you were transgendered? When I was about maybe, I don't know, 4, 5, 6, somewhere in that area, I had a dream, and in the dream, I envisioned myself as a boy. I was very excited. If you've ever had a dream where maybe you've won the lottery or something, you wake up and you're all ready to go spend that money, right? That's how I felt when I woke up. I was excited, I was stoked, you know. I told my mom and my grandmother about this dream, and they, you know, they didn't really know what to say. You know, I mean, your daughter comes to you, your granddaughter comes to you and says, I had a dream and I was a boy in my dream. Now, at this point in time, I am sure I had been displaying some other, you know, non-typical feminine behavior for girls and whatnot, playing with trucks and out in the creek, you know, trying to dig a hole to China, because my great-grandfather was gave me a swing set, so we're out there trying to dig for the post for the swing set, and I'm trying to get to the other side of the world. So my grandmother, I mean, I really remember distinctly that she turned and said to me after I made this announcement to her that I felt like I was a boy. She says, well, how do you know what a boy feels like? You know? And I remember thinking at 4, 5, 6, like, I don't really have the language for that. I don't know how to describe to you how a boy feels. I don't know how a boy feels, but I know that it probably feels different than being a girl, because all those things that society tells you, what aisle to shop in Walmart, you know, are you going to shop in the pink aisle or are you going to shop in the blue aisle? You know, we hear all these inputs. So how do we know really what a boy feels like or what a girl feels like? So some points to think about. I'm going to pop in a film. Some points to think about while we watch this. What age? You all are maybe studying these things about gender, and when do we as humans develop that sense of gender identity? Again, this is my grandma's question. How do you know what a boy feels like? And I couldn't come up with any good answer for her. So that kind of left me feeling like I'm at a dead end. I'm at a loss because I can't really explain myself. And not being able to explain yourself, even as an adult, that can be really frustrating. So, what influences our decisions regarding our gender? How do we express this? This is, like I said, this is one of my issues. What language does a 6-year-old have when they're trying to describe how they feel? Whether it be about gender or abuse or whatever it is they've experienced, how do they communicate that? The people that you tell, what are their reactions? And who can kids go to for support? I went to my mom and my grandmother, and they did the best that they could. I mean, but this was 1984, 85, 86. They didn't have any idea. Jerry Springer hadn't come out yet, and Oprah didn't have her life class, so we didn't know about these things. So we're opening up. This family has just moved into a neighborhood, middle class neighborhood, the French, so it's subtitles, but they're not talking a mile a minute or anything. They're having a sort of open house, and we're getting ready to meet the primary members of the family. Okay, so we get the idea, right? This is not a pleasant situation for anybody really involved. So that kind of takes us, hopefully that will take us back. Yay. So, keep in mind some of these questions that I put up here for us. Who could Ludovic go to for support, right? That's not going to try to change who he is. So, back to my story. I continued, to be a girl. I didn't really know at the time that it didn't fit for me. I mean, I knew that it didn't fit, but I didn't know exactly what it was called. I just thought I was just a tomboy or something, So I was always out, doing, boy activities or whatnot, playing in the creek, catching fish. 8th grade trip to Washington, D.C. I don't know if they're still doing that, but that was my trip. Great time. This is like freshman year. I came out as a lesbian, I came out as bisexual to my mom, my grandmother, circa 1995 or so. And they didn't really make too much a big deal of it, I think they were kind of hoping that it would just kind of be a phase, right? My mom actually made this dress. She really went into like super crafty, make you dresses kind of mode, because that was, I think, her way of trying to bring me back. I then later on came out as a lesbian. I was in love with this girl here, and that was a harder pill, I think, for my mom to swallow, because it was more definite. I think being bisexual, people kind of look at that as, well, we can kind of win you over sometimes, and maybe you'll stray, but you're kind of got your foot, on one side of the fence. This is prom. I went through a really strange period. I think that everyone does at some point in time. I really tried to identify with being a girl. I really, I wore makeup, and I was wearing the heels and my hair and doing my, all that stuff, because I was hoping that people couldn't see through me, because the person that I thought of myself looked much like this. But I was really trying hard to get this person to really be there all the time. And I think a lot of times, when people are either in denial about something or they're really hoping for something else, they go to the extreme, right? It's kind of, I think, human nature. Okay, graduation, my mom and dad, the hippies from way back, right? Looking much more like establishment here. So I graduated high school, I bought a motorcycle, I turned 18, and I shaved my head. So, being a grown-up, being a legal adult, I really found a lot of freedom here. I started going to OU, the main campus. I got kicked out, academically withdrawn, because the girl I showed you earlier, the girlfriend, she moved to Columbus, so I was commuting daily. I worked at a dining hall on campus. I would leave the dining hall, drive out to Albany, which is about 15 miles or so outside of campus, pick up my dog and change of clothes, and I would drive to Columbus. I'd get there about 10 o'clock, 10:30 at night, something like that, stay the night, get up about 5 o'clock in the morning, drive back to Athens, drop the dog off, maybe take a shower, and go back to school. So I didn't have any time for studying. I was not concerned about that, right? So I got kicked out of school. While I was in school and while I was actually involved in academia, I was reading some books, which I've listed on the handout that'll be on Blackboard. Gender Outlaw, Transliberation, As Nature Made Him. As Nature Made Him is a great book, not dealing with transsexuals. This is a book about a set of twins, boy twins, born in Canada. They went in a while after they were born, maybe 2 months or so after they were born, for their circumcision. The regular doctor that normally performed the circumcisions, he was on sabbatical, vacation, or whatever, so there was like an interning. Well, the first twin, he did okay, but the second one, he actually burnt a little too much off, right? Oh. So because this baby now has no working phallus, no penis anymore, they decided to go ahead and raise this child as a girl. So, I mean, it's just, I don't think you could get any better control. You know, you've got they're identical. You've got twins, you know, so you can actually see what happens. It's a very sad story. All the manipulation that goes along with people doing research that they know is fallible, and what the results might be. So I read a lot, and I started realizing that people were transgendered. That's the feeling. That was the label that went along with how I felt inside. I actually heard my own story in the voices of other people. And if you've ever been in a situation where you feel like you're all by yourself, you know, and then you hear those words from someone else, you're like, oh man, somebody else knows about it too. I was really involved in when I was living in Columbus, because after I got kicked out of school, I went ahead and moved up there because I was already spending most of my time there. I started getting involved with some of the drag king performances. That was a really great outlet for me to kind of be in a space, you know, where there are other people like yourself, you know, that are experimenting with gender, and it was just kind of a cool group to be a part of. This is said girlfriend. This is not us getting married, but we kept in contact, you know, and she's still my best friend. But, you know, talking about relationships, being transgendered, having these gender identity issues, you know, her folks are from, you know, down yonder, just like mine are, and they weren't really feeling the black thing. They certainly weren't feeling the transgender thing, you know. So talking about relationships, you know, like I said earlier, it's not just the person that's involved, it's everybody that knows that person, you know, has to maybe readjust themselves. I don't know if you can make it out here, right in this area. I've got a chest binder on. It's very uncomfortable. This is LA. It was hot. Hot, hot, hot. This is LA, about maybe 2003, is right before I started taking testosterone. But binding, I don't have time to show you the Boys Don't Cry, so I'll skip that out. If you do want the information, it's out there. If you Google passing, binding, you can look at the different prosthetics. That's the PC term. So for, you know, female to male people that might want a little bit of extra in the groin area, you know, if you know what I'm talking about, you know, there are things that you can buy, packers, so that you have a more male-looking profile in that area. There's also stand-to-pee devices, and that's for any women. You know, it doesn't matter if you're transgendered or not. If you are camping and you don't want to squat or whatever, you can buy a nice little contraption. Yeah, I mean, they come in. Great for people that have mobility issues, if you're in a wheelchair or something like that. But it's European, you know, and they're Europeans for the most part. They're kind of cool with gender, whatever, you know. So they make this. It's called the Whiz. They make it for anybody who might need it. So points to ponder. I am going to throw in this Trans America because it's got a pretty good section in here for those of you that'll be, you know, are you all going to be counselors? Oh, great. Okay.
While you were doing that, when you were talking about said girlfriend, did you communicate, like, as you're going through your identity process, and then I'm also thinking about what you were going through, just being a college student and then being like all those things, was she right along with you as far as communicating, or was it a struggle?
It was a struggle. I mean, it really was. Gender, I mean, we don't like to talk about sex. We don't like to talk about gender. We don't like to talk about people's body parts, you know, so when you've got an issue like this and you're trying to communicate about it, you know, it's very difficult just because our society already we're very interested in knowing about these things. You know, you turn on the TV and you can tell that people want to know. They want to know how you're doing it, who you're doing it with, and all these things, but we don't actually want to have a real dialogue about it. Adult conversation, exactly. So yes, always talking about gender is always difficult. I think for relationships, in terms of my relationship with her, when she, again, like I said earlier, it's not just you that's involved. Other people, your relationship with that person, they now have to see themselves through that relationship with you. So for her, she identified as a lesbian. By default, a lesbian dates women, right? And ideally, you would be dating a woman who identified as a woman, right? So for someone who identifies as a lesbian to be dating someone who identifies as a man, it can be very problematic. I have a partner now, though, in case I don't get to the slides. I have a partner now that I met online. He's a biological male, very content in his manhood. He's Chinese. He lives in Malaysia, so we're about 10,000 miles apart. Right now, it's about almost 7 in the morning for him. So we met online, and I really didn't have to explain my situation. I always make it a point to be very honest with people. I don't like, you know, life is too short to be shady, right?
I'm sick, her.
Yeah. So I'm always upfront with people about, you know, my situation, what I go through and whatnot. So fortunately, you know, he's knowledgeable. His parents, you know, we tend to think, I think, of Chinese parents, Chinese people in general, as being, you know, maybe austere or something like that. But his folks are very liberal, you know, very open-minded about a lot of things. So, you know, our situation was very blessed. It could have been a lot worse. So this is, I'm gonna make us watch all these previews. This is Transamerica. I had a little bit of bias. Actually, before I watched the movie, I thought, oh great, another campy movie about, you know, a drag queen, you know, because for marginalized groups, black, disabled, you know, poor folks, for marginalized groups, generally speaking, to gain acceptance into the mainstream, usually we've got to make fun of them first. So a lot of times, you know, trans people, you'll see the stereotype, that big, you know, 6'2", 5 o'clock shadow, you know, clearly a man in high heels and, you know, a bad lipstick job or whatever, because it's funny. It's not as threatening when we see people like that. Okay. So that was, I had reservations about that because I didn't want to see another campy trans movie. But I've seen this movie now probably 50 times, and I crack up every time. So Bree's probably not happy. Can you imagine? Like, imagine this is your life, okay? Imagine that every day you wake up and you go through your routine of how you're going to sound, what sort of pitch you're going to be using. I mean, this is a constant. And then imagine somebody else, after you've already gotten them to sign off on your paperwork, and they decide, you know what, no, you're just not ready. I mean, just you know, think a minute for how that feels. So basically, the Harry Benjamin standard of care, this will be what affects you guys directly if you decide to go into gender. I don't know, you know, what you'll decide to do. But it's basically an outline of how to treat transgender patients. And it's very detailed. For the most part, you need to have, you know, ongoing, maybe a year or so's worth of counseling. And when we think about, you know, what a counselor charges at maybe $150, $200 a session, it's not inexpensive. But anyway, so you have to have a therapist to sign off saying that you are of sound mind, even though you've got a disorder. you're of sound mind to go ahead and begin hormones. And then if you want to have surgery, then you have to have a surgeon to sign off saying that you're ready for surgery. So a lot of checks and balances, and for the most part, trans people, we're not really feeling this too much. It's too much policing that's involved because we have to wait, no offense, but we have to wait for you guys to decide for us what's appropriate. Other people, if a woman wants to go out and get, triple X double Ds, walk around, she's got to have a gurney to help support her weight. Nobody really, nobody says anything about that. But if you want to change your gender, we got to, stop the presses. Okay, so very quickly, I take testosterone once a week, about 0.5 ml dosage at 200 milligrams a milliliter. I do it intramuscularly. Different stages here of my surgery. This was right after, a few weeks after, a couple months after, and last night. So you can kind of get an idea of what the chest surgery is like. Because I was already a small size to begin with, the surgery wasn't very invasive, but you will have some people, if they're a larger size to begin with, they have basically a double mastectomy. Okay. You have all sorts of different types of surgery too that are involved. This was a keyhole. It was just a basic nipple graft. It cost about like $5,000. My mom paid for it. She also was my nurse, so yay, mom. Once I started taking the testosterone, and particularly after I had surgery, you don't really realize the things that the walls that you put up, the way that you can limit yourself, particularly if you have a body image issue. So I hadn't been swimming for years. I love swimming, but I just did not feel comfortable, particularly after I started growing a beard. You're not going to catch me in a two-piece, right? So after surgery, though, I really felt like I got into my own groove. And if you've ever had a time in your life where you're like, yeah, this is it. This is who I'm supposed to be. Like, it's an overwhelming feeling. So I came back to OU, I did geology and plant biology. I finally graduated after like 10 years. My partner, I went to meet him for the first time a year ago, February. And then in December, he came here to visit me and my family. We went up to Cleveland and we made our own rings. Now our loophole here is that because I'm still legally female, we should be able to legally get married. So we started the immigration process. We filed for his fiance visa. So keep your fingers crossed for us, if you will, that we'll be able to do this and not have too many issues. That's really all I have for you, and it's about 2 or 3 minutes till, so I'll definitely answer any questions you have.
Well, yeah, I have we were discussing this, that I have an issue with a gender identity disorder, and I was just kind of wanting your take on it. I mean, they took the homosexuality out of there, but you seem, I mean, you seem very put together and you seem very happy. So, I mean, is it just a disorder when somebody is uncomfortable and is causing havoc in their life? Or, I mean, I don't get it.
I mean, I'm certainly not, again, I don't speak for everybody. For me, the disorder comes into play when, like we saw with Ludwig, his parents weren't feeling him wearing dresses and being a girl. If he had been, or she had been left alone to grow and wear dresses or do whatever, is there a disorder? Is the person maladjusted? Just because society says you're not doing it right doesn't mean that you've got a disorder. I mean, for a long time, left-handed people were thought to be, I'm left-handed, do I have a disorder? No. I live in a right-handed world, so some of the situations that I encounter do make me feel disordered, right? But that's really, I think, a reflection of what society tells me that I should be versus me actually being left-handed, going around. I don't have any disorder. I can write just fine, So I think it depends on who's doing the labeling. I think that if more transgender people, we know when we're kids, just like if you're cisgendered, you knew that when you were 6, 7 years that you were a girl and that you were fine being a girl. Boys know that they're fine being boys. When people know that they're not fine being a boy or a girl, I think that if we allowed them to do what they felt they needed to do, I don't think there would be a disorder. I think the disorder comes in when they're restricted from that.